Bismillahirrahmanirrahim. I'm Dr. Mohibullah Wazir, and the topic is the lungs. The lungs are an organ of respiration, and these lungs lying one each in the thoracic cavity. This is one lung, and this is another lung. It is connected with the larynx and then with the atmosphere through the trachea and the bronchi. Now, each lung lying in its own side enclosed in the pleural cavity, that is parietal and pulmonary pleura, and when you feel it, it is crepitant to touch and it is full of air. When you put it in the water, it will float. But if the child is born stillbirth, that is, the child is not taken respiration and the child is dead intrauterine, or if it is involved by some disease, consolidation, or having mass in it, then if you put in water, then it will drown in water. Otherwise, it will float in the water. And then at birth, the color is red, pink. But later on, when the individual lives in the atmosphere and take respiration and carbonation particle goes in, then it becomes the color then from pink or red to then brown and then to black, depending upon the atmosphere. And the two lungs are connected in the midline, look, through the bronchi with one another. This is the trachea, this is the right bronchus and left bronchus. In the same way, the arteries and veins also comes from over here. In this way, the two lungs being connected over here to the mediastinum. And inferiorly, each lung rests upon the diaphragm, which is concave toward the abdomen and convex toward the thorax. And each lung, it have note: the apex, the mediastinal surface, the sternocostal surface, and the inferior surface. The apex of the lung, which lies over here above the clavicle in the root of the neck, that is being crossed, you can see over here, by the subclavian vessels. But the subclavian vessel, artery and vein are separated from the lung tissue by the dome of the pleura. That is, it is covered by pleura and suprapleural membrane, and then at superficial that lies the subclavian vessels. Then the mediastinal surface of the lung, you can see it over here, it is in contact with all these organs, that is the heart, the aorta, the esophagus, this one is the esophagus and the trachea, and descending to the aorta. In this way, the mediastinal surface is in contact with all these structures, and this structure produces impressionability as well. And this margin of the lung, it is called as anterior margin, and this anterior margin separate the medial surface from sternocostal surface. And the anterior margin, look, of the right lung, it is straight, while of the left lung, it is notched over here, this notch. And this notch is being produced by the encroachment of the heart more toward the left side, and it's called a cardiac notch. And this lower end of the anterior border, it projects more in the form of tongue, which is called as lingula, and this is cardiac, this called as cardiac notch. And in this area, note the point, the heart is not covered by the lung. Otherwise, the heart from all around is covered by the lung. That's why if you percuss this area, it will give you the dull sound. Otherwise, if you percuss over the lungs, because the lungs are full of air, it will give you the resonant area. This will give you the dull percussion, just like your percussion on the stone. Okay, and then this inferior sharp border, look, it separates this diaphragmatic surface concave from the sternocostal surface, and this inferior margin It comes over here. Look, this inferior margin of the lung. It comes over here to reach into this costodiaphragmatic recess of pleura. But note, this lower part of the pleura is not being occupied by this inferior margin. So this lower part of the pleura remains empty and is called a costodiaphragmatic recess of pleura, and in X-ray it is called costophrenic angle. And then this posterior border or this posterior surface which is rounded and which is in contact with the ribs, and the medial surface is having this vertebral part which is in contact with the bodies of the vertebrae, while this mediatal part it is having in contact with the mediatal structures. While present over the mediatal surface there is a small concave area that is called as hilum. And hilum is the area through which the bronchi, the pulmonary arteries and veins and bronchial arteries and the lymph nodes, it enters into the lung and leaves the lung tissue. And these structures which make these are called as lung root structure, while the depressed area is being called as the pulmonary hilum, and the part of the pleura around this lung root structure that is being called as pulmonary ligament. This is short concept of the lung.